And of course, going through menopause is a normal phase of life for all women, but it may occur earlier in some women, as Dr. Feldman just said. We have a list of risk factors that we'd like to show you according to the Mayo Clinic. Doctor, these are obviously, smoking is a big one.
So the reason smoking is a big one is smoking is a toxin. So the nicotine and the tar and so forth are toxic to the ovaries. So women who smoke have a harder time getting pregnant. The smoking is damaging to the eggs, so you run out of eggs earlier. Family history. If your mother or your sister had an early menopause, you're more likely to have an early menopause.
And we talked about my family history. I had mentioned to you that my grandmother, who lived to be 96, God bless her, and my mom, they really didn't experience a lot. They both told me that it was a walk in the park.
So you're very, very lucky. And I would tell you about 25% of women have what I'll call a seamless menopause, where they just all of a sudden, their period stopped, and the next thing they know, it's 3 years later, and they go, oh, I missed it.
That's great. So I'm maybe that 25%?
Maybe
1 in
that's
4.
you.
Let's see, because I've also heard it could just come with a roar.
And that's true, too.
Like a lion. Let's go back to that graph and show some other risk factors.
The next thing on the list was cancer. So cancer treatments, so chemotherapy or radiation therapy can damage the ovaries and increase the age of menopause or decrease the age of menopause. And then hysterectomy, because what you've done is disrupt the blood supply that goes to the ovaries, and so then the ovaries begin to get older faster, and then you go into menopause.